Hello and welcome to session 2 for your community health and wellbeing worker. So today we're looking at duty 1. We're going to do a deep dive into this. We're going to run through the aims of the duty. We're going to look at the knowledge and the skills required for duty 1. We'll talk about some of the things that you can do to apply it back to the working role. And we're going to look at the formative assessment, so the end of the duty assessment, to show that you've understood enough around the topic. So I'm going to share my screen with you now. Bear with me while I do that. There we go. And on here, you can see you've got everything that I showed you last time. Your recorded sessions are here. This is where you're going to find this session later, although you'll know that because you're watching it, right? So I don't know why I said that. Okay, so let's have a look at duty 1 now. Now, duty 1 has some homework reading. So all of the duties, as you're going through them each month, start off with some reading material. And the idea of the reading material, you can download this. So you can click on there, download that into your wherever you want to download it to. And yeah, it just runs through the knowledge of the skills. It's a helicopter tour, if you like, of what it is we're going to be covering. And if you read it, it's going to prepare you a bit more. So let's have a look. So duty 1 then, we're looking at approaches to promote health and well-being of individuals, of groups and community, and addressing the wider concerns around health and the causes of ill health. You've got 5 knowledge here and 4 skills. So knowledge 1 then is the wider social issues around health and the impact on physical, mental and emotional well-being for families and communities. We're going to look at the cause of mental, emotional and physical ill health, long-term health conditions, disability, premature death in local communities with risk factors. We're going to look at the negative and positive impacts that different agencies can have on health and well-being. We're going to look at how psychological, behaviour and cultural factors contribute to physical and mental health and well-being and impact others. And then we're going to look at some health inequalities and how these impact on physical, mental, emotional health and well-being. And then the skills, so this is what we want you to be able to do by the end of this duty. We want you to be able to recognise and help others, also to recognise the factors that impact on personal health and well-being. We want you to assist individuals, groups and the community to recognise their health needs and the importance of them and looking at their strengths. We want you to help people and groups and communities to identify and address barriers and that can be overcome to achieve health and well-being. And we want you to work with people to communicate, to identify and address local resources to assist. So really what we're looking at here, the knowledge and the skills are interlinked. You'll have a bit of theory, then there's a bit of the practice. And what we want to do, or I'm hoping by the end of this session, I will have put this into a much more workable understanding of what the standard is trying for you to achieve. So the presentations are here. We'll run through the presentation quickly and then we can move on to the learning material. So here we can see preventing ill health, a holistic approach to promoting health and well-being. So by the end of this session, you'll have a better understanding about promoting health and well-being, looking at its prevalence, looking at groups of community, wider health issues, cause of ill health, social problems, economic problems, environmental problems, behavioural, targeted vulnerable groups, health promotion strategies, educational, psychoeducation awareness, behaviour change interventions, policy, legislation, community development. Excuse me. Oh, excuse me. Collaboration, partnership, measuring success, indicators of success, barriers, sustainability, policy recommendations, community recommendations, individual recommendations, and then some referencing. There's quite a lot to get through. So let's just look straight away at promoting health and well-being. And when we talk about health and we talk about well-being, let's be very clear on what we're talking about. Health, we're talking about the physical health of an individual. Well-being, we're talking about the mental health of the individual. So put the two together, we have health and well-being in a nutshell. So here we're looking at the promotion of health and well-being in today's world. And again, it's much more complex with a lot more data, a lot more information, but a lot more pressure on individuals than we ever have in the past. So we're here to focus on numerous health conditions. And if we just think about the common health conditions that people are experiencing, so we're going to be looking at things around cardiovascular diseases, respiratory problems, and again, the neurological problems and mental health problems. So just keeping it nice and broad there. It's essential to understand how we can take preventative measures to promote better health. So again, when we think about promoting health and well-being, it's in the title, it's called promoting. So looking at government strategies that already exist. So we're not asking you to come up with new ways of managing things. There's a lot of government agendas out there, lots of things around smoking cessation, drinking, eating fruit and veg, 0 to 5K, exercise, 40 plus NHS health checks, screening for cancer. There's just so many things out there. It's just about you becoming this point of referral for you to pass on this information. It's called psychoeducation. So your role here is to understand different government strategies, health promotion strategies, and to look at how you can use those within your place of work, or just to understand them, to really get behind them, to be able to promote that and look at kind of ways forward. And again, the other one we had was time to talk for your mental health stuff. So promoting health and well-being isn't just about avoiding the illnesses. It is about living your life fully. And by taking care of ourselves and those around us, we can create a happier and healthier society. So I think that's fair enough. Preventative approaches is what it says on the tin, right? It is about taking those steps now to reduce those risks in the future. So the whole point of a community health and wellbeing practitioner is about understanding healthy lifestyle choices. Now, you're not here to preach. That's not what we want you to do, but we want you to be able to give information to people about health and wellbeing approaches. And therefore, one of the first things you need to do is start to collate that information together to create your toolbox of health and wellbeing strategies. Because the more you have up your sleeve, the easier it is for you to give those out. Excuse me. Apologies, it's been a very long week. So I will soldier on and try and do this before I drop off to sleep. So it is about making sure that we have a good understanding about chronic illness, where chronic illness comes from, and then the things that we can do to manage it. So even once we have a health condition, we can prevent it from becoming worse. So again, things such as if we talk about diabetes, for example, we know that there's lots of evidence out there that if we start to reduce our sugar and cholesterol intake, we can reduce diabetes maybe from type 1 to type 2. And if we keep going, there's a chance that you could always eradicate that in the long term. But if you have type 2 diabetes, then actually, and you change your lifestyle and diet and you eat well and you exercise and you drink plenty of fluids, then you can stop that going to type 1. So it's about that kind of information, advice and guidance. Equally, we're talking about other things, and without becoming controversial on this, things around vaccination campaigns. So the flu vaccination, because again, preventative, COVID vaccinations, shingles vaccinations. So they're campaigns that are out there every year now going around. So just understanding those vaccination campaigns can really help because you need to know who the people who are eligible for those, because there's certain criteria, and where you can go for them, because again, trying to reduce those burdens. So if we think about health promotions and we think about vaccination promotions, we should come up with a lot of stuff there. And I'm going to be writing some notes down as I do this. So I want us to look at health promotions, because I'm going to put this in your, not advertisements, your announcements. So we're going to look at health promotions and we're going to look at vaccination campaigns. And what I will do in the announcements, I'll add some of the stuff that I know. Because ultimately, we need to address root cause of ill health, looking at those better preventative strategies. So we need to be mindful that we do this in a supportive, encouraging way when we're talking to people, and not in a lecturing way. Part of what we need to do is to identify those groups and communities. Now, this is quite important because different community groups are at risk of different conditions. So if we think about groups of people, for example, the LGBT+Q community, we are more at risk of conditions around mental health, depression, anxiety, body dysmorphia, things such as that. Equally, we've got transmissions around sexually transmitted diseases, alcoholism, so addictions. And again, if we think about HIV and AIDS, and actually there is a rise of HIV and AIDS in the straight population for 50s plus, and we'll talk about that in a second. But without stereotyping, because we want to stay away from that, those groups are more at risk. We're talking about a more at-risk category than say you are going to. It's just the evidence suggests that that group is more at risk than others. But equally, if we think about the Asian population, they're more at risk. Not necessarily Asian population. Which one is it? One is at risk of liver. There's something to do with liver and enzymes. I want to say Nigerian communities more at risk of diabetes, I think is where the evidence suggests. But again, knowing those community groups, looking around that. And again, that's going to be lifestyles, so the way that food's prepared and et cetera, et cetera. So just knowing those groups within your community and different types of community groups, obviously without stereotyping, there is that. Equally, for example, the travelling community, they face discrimination, they face barriers in accessing primary healthcare services. People with mental health have a barrier accessing primary and secondary services because the NHS do not tolerate, they have that no tolerance for verbal abuse or aggressive and hazardous behaviour. Unfortunately, that's the byproduct of some of the mental health conditions. I worked with a gentleman in London who was visually impaired, diabetic, he got foot ulcers, there was a lot of mental health issues there. And because of the pain and the stress, he had HIV. I think he had HIV off the top of my head. I think there's a HIV that affected his obviously his white cells for infection. So with the diabetes, the HIV and all of this stuff, his life was very problematic. But because he was unable to maintain his anger, he was barred from everywhere. So we couldn't get him a GP. We couldn't get him seen in hospitals. And then it was full-on crisis. So it was always into suicide, crisis prevention. So trying to understand his barriers was a real problem. So we can see here, preventative approaches are key to promoting good health and well-being for individuals. It is about understanding those groups of communities. by taking action before problems arise can prevent illness and overall quality of life for individuals. Getting regular checkups, that was the other one. So there are certain community groups that don't like going to the hospital or the doctors. So again, just making sure that they have regular checkups. And for groups and communities, looking and implementing policies to promote healthier behaviours. And, you know, one aspect of preventative approach is addressing the social issues of health. This includes factors around income, education, healthcare. So inequalities there as well. By addressing these underlying issues, we can create a more equitable or equal society. So it shouldn't be a postcode lottery about who has a better lifestyle and who doesn't. So looking at wider determinants of health, the wider determinants of health refer to social, economical, environmental, and cultural factors. So if we think about models of care, we've got the medical model of care, so the doctor knows best, I'm going to tell you. We've got the biosocial model of care, so looking at health and well-being, and we've got the social model of care, which naturally looks at society being discriminated because the world isn't built for people with a disability. Our economical factors can be where we live, so looking at employment, looking at kind of unemployment. If we look at some factors around community groups. So, for example, I was interviewing somebody in, I want to say it was Bromley area when I was in my community training. And when I was talking to, I think they were about 16 or 18 years old, and I said to these young people, I said, you know, what are you hoping to be when you finish school and you go to college and stuff? And they said, oh, well, I'm just going to be on benefits. Why would I work? My mum's never worked, my dad's never worked, my grandparents have never worked, and look at the lifestyle they've got. And they then mocked me to go, well, look at you, you're working really hard, and what have you got? So there is a lot of stigma, there's a lot of education, there's a lot of working with this cultural factors around health and well-being, and trying to give people purpose back in life as well, I suppose. So, for example, individuals living in poorer area with poor air quality might be at a higher risk of respiratory populations. People living where there's food deserts. What we mean by food desert is there's no real food shops, it's all corner shops or takeaways. So they don't have access to high quality food. Social factors such as education, so postcode lottery in with schools, and then housing impact, because obviously housing, depending on your house and the quality of where you're living, can obviously be a real determination on your respiratory system and health and well-being. So looking at causes of ill health can have a variety of causes ranging from genetic factors, so things that we're born with, to environmental influences, to things that we perhaps, as we were just about, around air quality, things like COPD and respiratory stuff. And some common causes of poor things such as diet, so things like diabetes, cardiovascular problems, lack of exercise, respiratory, cardiac, musculoskeletal, so moving the body, pain and stuff like that, and exposure to toxins and stress. So people working on a high level of stress, think of hypertension, high blood pressure, diabetes, poor lifestyle, lack of sleep, and ultimately probably setting us on a really lovely path for dementia, because we're just burning out our brain. I say we because I put myself in that category. And interesting, so if you think back to Margaret Thatcher, for those that remember her or might have known her, I've just shown my age, haven't I? But Margaret Thatcher, who was our Prime Minister, she used to sleep on 4 hours a night. And eventually she was diagnosed with Alzheimer's and dementia. And there was a recent study done that suggested people that have poor sleep hygiene, that are exposed to high levels of stress and lack of sleep, are more at risk for dementia. So again, think about those preventative measures. So you can now go home to your partner and say, Steve says, I'm not allowed to be stressed, I need to sleep more. So again, just thinking about how we can work together to reduce that. Now, ultimately, I am not at all saying you can eradicate it. And in fact, there is a really great speaker that does a TED talk that says, look, in some situations, we all need stress, because if we don't become resilient. And actually, our body is designed to take a certain amount of stress. So it is this balancing act. But looking at that, the prevalence around that, looking at some of those approaches to address those ill health, looking at promoting healthier eating habits is absolutely key. I'm going to sneeze, so I'm just going to pause this for 1 second. So it is about looking at different strategies. Now, again, I am absolutely aware that things like exercise and eating well and all of this stuff costs money. But there are simple things that we can do that do not cost money, that we are able to share. And knowing what's in your local community is key here, because some parks have gym equipment. Most county councils have things like an active programme. So down in East Sussex, we have Active Hastings, where they have walking groups and jogging groups. And it doesn't cost anything to join. They do football and basketball and lots of sporty stuff. It just takes us to talk to our local councils and say, look, what services have you got available that we could offer to either our staff or the people in which we are looking after? And again, there's a process called social prescribing. So social prescribing looks at ways of problem solving, so critical thinking and problem solving. So listening to maybe somebody who says, look, but I've got 4 generations of cancer in the family. Let's say it's genetics. So there are now early stage genetic screening tools out there. There's genetic screening tools for dementia. So we are in a great position to be able to know if we need to do more preventative work. Cholesterol, diabetes, all of this stuff. There's things that you could just say, maybe you should go to your GP and look at this. Equally, we know that people in their 40s moving on, things, you know, women around the menopause, and for men, the menopause, drop of testosterone, greying, feeling tired, lethargic, becoming a bit more grumpy, unable to concentrate. And some of the other things that we are much more acutely aware of are neurodivergent. So things such as ASD and ADHD, and everyone's on that, no, but everyone's got it. No, we're now just diagnosing people because we didn't diagnose them for the last 30, 40 years. So of course there is generation backlog. We just now know what it is. So lots of things there. So looking at those social determinants of health. So when we talk about social determinants of health, we refer to the social and economic environmental factors that can impact on individuals' health and well-being. These factors include the likelihood of income, education, and housing. So social impact stuff. And there's some great work coming out of Public Health England about levelling up and social inequalities. And there is a lot of work around social inequalities. I was part of a steering group last year about levelling up and looking about narrowing gaps. So things such as apprenticeships narrows gaps on education. It's there. We need to use it. You know, there is no magic wand. It's a lot of work that people have to put in. So, but there is support there. So research has shown that social determinations have a significant impact on overall health and well-being of lower socio-economic backgrounds and often experience poorer health outcomes. Prevalent approaches can help address social determinations of health, causing improvement access to resources and services. And we are now living in a connected world. So with the internet and IT and our phones and learning all now going online, there are less reasons. And especially with education being more flexible, so you don't have to choose between family, work, and life. We can study in our own times. And the reason I'm yawning is because I study early in the morning, so I get up around 4:30, 5 o'clock, and I do a couple of hours of my masters. And then I work throughout the day, and I can fit my family life and all of that stuff in, and then I work again in the evening. So I do long hours, but I do it because I want to move myself out of certain brackets and into the next bracket. And therefore, it's about a sacrifice. You have to be prepared to make changes. And as I was told by my matron once, it's long-term or short-term pain for long-term gain. And if we look at the economic determinations of health, so economics of health and social economics health influence the health and well-being. These factors include income and employment status, education, access to healthcare. So research has shown those living in poverty or with lower levels of education are more likely to experience poor health outcomes. And again, we can surmise why that is. However, there is a great program on Channel 5 called Benefits Britain. And I absolutely love that program. It's quite easy to watch, but what I love about it is the people that are on that program are living proof that just because they live in poverty, they have to have a poor outcome. They are all on benefits. They are all in social housing. They are all on the breadline. But because of that, they have made it a full-time job to live well. And there's one lady, she does all her coupons and she collects everything. And each week she saved like 60, 70 pounds just on her shopping. And it's just incredible. There's another lady who's on there who lives like a queen and all of her stuff is designer. I mean, I don't even own designer stuff and all of her stuff's designer, but what she does is she saves a couple of pounds a week from her benefits and she goes shopping once a month to buy some stuff from a charity shop and she'll always find the nicest bit. And there's another person that buys in bulk and she does have, so she's got a family of 3 or 4 or something, and she's able to plan her meals at £1.50 head for the whole family. It's just incredible. So there's no difference in the amount of money that the house has been given. So I do struggle a little bit when we look at poverty and people say, but I'm on benefits, what do you expect? Because actually that programme, Benefits of Britain, Benefits on Britain, or Brits on Benefits, it goes to show it's not about that. It's to do with the attitude. It's to do with the knowledge. It's to do with the drive. It's to do with the cultural factors, probably more so, on how to live well for less. So it is possible to have good outcomes. We shouldn't be just assuming people on benefits can't live well, because ultimately, even people that work full-time jobs sometimes don't earn anywhere near as much as those that are on benefits. So just because you have a full-time job doesn't necessarily determine the fact that you're going to have more money in your bank account. So what's different is, though, that they're able to maintain themselves and get into a routine and stuff like that. So maybe that's what helps. But we can explore that as we go on. Environmental determinations of ill health. So environmental determinants of ill health refer to physical, chemical, biological factors. And this obviously influences health and well-being, including air population, water quality, housing. Do you know what? This one always reminds me of when I go back 20 years, a bit more than that actually, probably now, probably 25, maybe 30, probably 30 years now. I went up to Brown Hills in Birmingham, and I went to a hotel because I was going to a training venue, and I run some water to brush my teeth or something, and brown water came out of the taps. I said to the lady, said, look, I think there's something wrong with your plumbing. And she said, no, that's the quality of the water up here. And it kind of took me back because I was just thought, what, in England? And I remember my English teacher, he had really bad brown teeth. And when I said to him, I said, oh, no, he told us, he said, oh, the reason I've got brown teeth, where I come from, we don't have fluoride or something in the water that keeps your teeth clean and white and stuff. And I was just gobsmacked that was in England. I just, why, how? It just didn't make sense. But anyway, it's absolutely true. So just thinking about this is really important because, you know, it is a bit of a postcode lottery. Also thinking about those respiratory problems. So if you're living in a built-up area, respiratory problems are going to be a thing. You know, I know when I was working in London, I found it really difficult. So I've been asthmatic since the age of 3. But the moment I come towards the coastline, my breathing absolutely changes. I don't need antibiotics. I don't need steroids. I don't need anything. But if I'm in a high populated area, it really affects me from a respiratory point. So again, absolutely true that where you live determines some of those health factors. So just knowing some of this about your population where you are is really helpful. So behavioural determinants of health. So behavioural determinants of health refer to the impact of lifestyle choices and habits. So again, choices, we are entitled to make unwise choices. We may not understand them, but we're entitled to them. You know, and those choices could be around drugs, alcohol, fast food, chocolate, sugary stuff. And habits, again, it could be poor health habits or whatever it is, you know, just binge watching TV, never go for walks or things like that, or perhaps just a workaholic. But they obviously affect the overall health and well-being of people. This includes factors of diet, physical activity, smoking and alcohol. So those approaches can address those behavioural determinants by promoting healthier behaviours. And there's lots of stuff to help promote healthier behaviours. So there's lots of psychoeducation, lots of cognitive behaviour therapy stuff. And there is a lot of resources online. So again, that's quite an easy win to give people information about behavioural issues to promote health and well-being. Oh, did I? No. I thought I'd lost the screen there. Bear with me. So targeting vulnerable groups then, as we were saying earlier, there are certain groups that are more vulnerable than others. And that could be our vulnerability around our older or elderly population. It could be the LGBT community population. If you think about what's just happening in the news regarding our transgender community, there's lots of problems there when we've got governments making public speeches. Whatever your belief there, you're obviously entitled to it. But one of the things that we promote in England is tolerance. And the other thing that we promote is fairness and equality, diversity around protected characteristics. So I think it is obviously very detrimental to minority groups when people in parliament or government target them and use them as political agendas. So it's important that we look after those vulnerable groups. So children, pregnant women, the older population, you know, the clinically unwell population. So again, thinking about COVID, those high-risk category groups. And the problem with that is all of those groups face discrimination and stigma And part of our role is to be non-judgmental and to be mindful of the language in which we use to reduce stigma. And that's not to say we always get it right, because it's impossible, but just to be mindful about language in which we use. So, for example, if we're talking about the aging population, that we're mindful that not everyone that's in that category is not spritey. I mean, when you look at Strictly Dancing, we've got Angela Riplin, who I think's in her early 80s, late 70s, early 80s, and she's kicking her leg above her head and spinning around. And yet we've got the youngest person with dementia in the United Kingdom, who's about 19-ish. So it's about using language which is inclusive and not hurtful or harmful. So stigma is a real problem around mental health and all of that stuff that we need to still be working on. And the more we can do to improve stigma, especially in certain groups and communities, the better it is, and the more free people can be to talk. So using preventative approaches such as education, awareness campaigns can change then community groups to have a better understanding about health and well-being. And again, if we think about, in a lot of cultures, men are meant to be the breadwinners, they're meant to be the strong member of the family. There is a reason why male suicide is more prevalent in men than women. And there is a reason why men in their 40s to 60s are more likely to commit suicide than their counterparts. So thinking about stigma, if we say to men, it's not okay to cry, if we say to men, you must be strong, you must do this, you must do this, you must do this, we ultimately put so much pressure on people that ultimately they feel there's no way out. So understanding stigma, understand that pressure will give you an idea of how you can support somebody. So looking at health promotion strategies then take into account or can take action to improve health and well-being by addressing underlying causes of poor health. They also target towards specific groups. So again, when we look at those health campaigns, they are designed. So prostate checks, I think it's above 50, I want to say, something like that. The NHS health checks above 40. For the females, the cervical cancer, the breast checks, mental health, time to talk. Each campaign is designed in its own right to hit that target audience. So for you as a community health and wellbeing practitioner, just knowing those health promotions will give you an idea of your target audience. And obviously, you can then talk about the benefits of each one and what they're about. But equally, you're doing it from an information, advice, and guidance point. You're trying to say to me, oh, are you aware of this campaign? Look, here's some information on it. Let me run you through some of the key features. You are not at all telling somebody that they should do it. We have to accept that our role is about providing psychoeducation. We are not there to influence somebody one way or another, because we cannot be seen to be pushing people to do something, and we cannot be seen to be taking away choice. But choice is it's impartial. So we can go, look, here's some information about smoking cessation. This is what the service is. This is what the service does. We're very matter of fact about it all. We don't have an opinion. This is what the service is, because the moment we start having an opinion, people feel judged. And if people feel judged, they're not going to talk to you. So keep the psychoeducation and don't do it so it comes across as a lecture. I've got some information on this. I don't know whether you think it'd be helpful. Here, let's have a look. Again, education and awareness. So psychoeducation is wonderful. It's a really powerful tool. You can promote health and well-being, and through education, you can change stuff, because ultimately, the education itself does it. And there's loads of stuff online, loads of things. So again, It's about the relevance to the people. And remember, different learning styles. People want information in different ways. So if English is a second language, can you get it in different formats? If somebody finds it difficult to read, can you find them a YouTube video? I mean, we have so much information, it's ridiculous. It's your job to find the right information for that person to help educate them. Behavioural change interventions. So behavioural change interventions looks at ways that we can promote health and well-being by encouraging the individual to adopt healthier behaviours. And ultimately, healthier behaviours comes from a thinking strategy, or talking therapy, not talking therapy, cognitive behaviour therapy. And that's used to treat a lot of mental health conditions. And CBT looks at the thoughts, the feelings, the emotions, and trying to get people to look at patterns of how they think, and how what they think is what makes them feel. And when they feel like that, they do something. So, for example, let's say when I'm stressed, I might start sitting there banging on the table, rocking myself a bit. And when I'm stressed, that normally triggers me to have a cup of coffee or a can of Red Bull. And when I'm stressed, I like to eat crisps. Let's say that. So that's my behavior. My thoughts are, oh, I need something to help me because I'm feeling stressed. So I need something to help me. What helps me? Oh, Red Bull, coffee, crisps. So all the stuff that's dopamine rewards. Give myself a dopamine reward, I'll be all right. So thoughts, feelings. So my thoughts are I fancy that I'm stressed. My feelings are I'm feeling more anxious. And of course my behavior is I go straight to the crisps, the coffee and the Red Bull. If I can change my thought at the beginning, which is, am I stressed? No, I'm not stressed. I'm feeling slightly overburdened. So that's my thought. My feelings would be, well, what would keep me well balanced? So maybe I need a bit of exercise. Maybe I just need to 10-minute walk away from my computer. Would that help? Would that make me feel better? Okay, that might make me feel better. Okay, so that's going to make me feel better. What is now my behaviour? My behaviour is I have to get up and walk away. So it's a really raw way of doing it. You will do, as we progress, you're going to have your logins to the mental health nurse online learning. And you'll do a couple of therapy types just to learn those therapy types. So you're not training to be therapists, of course you're not. But what you can do is use the principles of therapy to guide people. Why not? It's helpful. And there are CBT tools there. So there's lots of stuff online that can help you manage people's thoughts, feelings, and behaviours. So when we look at policy and legislation, again, these can be helpful, ways to promote health and well-being. Some can be helpful, some not so helpful. So if we just think about a recent thing, so it's on here actually. So looking at the examples of policy that restrict advertising to sales of tobacco products. Great. So we took away the adverts, we covered up the tobacco, we've increased the price, and then we brought out vaping. Now, I know the government stance and the evidence suggests that vaping is better for you than smoking. I do have a problem with that. And my problem with that is I just don't think there is enough evidence for us to be saying that. My gut feeling as a professional is your lungs are meant to be dry. People that vape are inhaling vast amounts of fluid directly into their lungs, causing far more lung infections, inflammation, pneumonias, And we won't know the long-term effects around things such as cancers for probably 10, 15, 20 years, because we've got to see what that does in the long term. I mean, let's face it, if we go back 20, 30 years, we thought it was okay to smoke. So I think we've just got to apply a bit of common sense. I struggle when we say to somebody, this is better than what you were prior doing. I think sometimes what's more helpful is moving away from a strategy, then go from one poison to another. So yeah, be mindful about some of this stuff, because whilst it's legislative, whilst it's a policy change, sometimes I don't think we get it necessarily right. But again, you know, it's there. For example, I saw that there's this push for smoking to go up to the age of 25. And I saw a counter argument that said, but all we're going to do by pushing the age up of the cigarettes, you're going to push people into vaping more, because you're now going to make that more accessible, etc. Is that the right thing? You know, at the end of the day, people still have the right to make unwise decisions. And should the government be legislating what we can and cannot do? You know, as it is, we've got the sugar tax. As it is, we've got the cutback on alcohol. As it is, we've got the... Great. Well, oh, and we've got the ULAS and all of that lot. Where do we draw the line until we're all eating carrots and drinking water? So we need to be mindful because of ethics. We need to be mindful because we live in a free country, and a free country means we have the right to choose, and we have the right to make unwise decisions, and we should be judged for that. It's our life. There are decisions. So just be mindful when we look at policies and legislation. So just because it's written, does it make it ethically right? We'll debate. Community development then. So working within communities, promoting health promotion strategies, working on behalf of other organisations, looking at those approaches to recognise communities, working within those diverse ones. They have unique needs and strengths, and we can use health promotions to empower communities to take ownership of their own health and well-being. And that might be things through community churches, through mosques, through support groups, where we can all come together to manage that. Good. So, again, when you target your own community groups, not your own community groups, but when you target community groups, just be mindful to adapt the psychoeducation to those groups as well. Because it's not one hat fits all. It needs to be personalised. It needs to be personal-centred. So we talk about personalisation and personal-centred practice. In a nutshell, personal-centred practices are when we put the person at the centre of what's going on. So if we just think about community groups, what we might say to one could be quite insensitive towards another, or not relevant as much. So just working our way around that personal sensitiveness. Excuse me. Okay, so looking at collaboration and partnerships. So collaboration and partnerships are essential components to any successful health promotion. Now, again, what's interesting here is the biasness behind health promotions and who's pushing it. So, for example, if we go back to vaping, who paid for those studies? Was it the companies that created the vapes? Because if it were, that's a bit biased. We've had many scandals in the United Kingdom over the years, especially I can think about antidepressants, when antidepressants were being pushed onto everybody. And it just so happened that the pharmaceutical company were rewarding all of the GPs and the doctors for prescribing them. So it's important that when we look at collaboration and partnership working, that we work in a way where we are promoting better outcomes, but we're not providing fake news. We're making sure that the source is reliable, that's come from good data places. And partnership working can take place in many forms: public, private, community partnerships, and cross-sector partnerships. So again, that could be working across NHS, private fields, etc. And equally, partnership working might be the fact that the GP surgery could be doing some stuff, the pharmacist could be doing some stuff, the local walk-in centre could be doing things. Or again, you could be creating networks within your own organisation. So, for example, you could have a health check day at your local church, and you just take some equipment down. I mean, there's just so much partnership work we could be doing here. We could be doing like things for charity. So you could have like a blood pressure event thing where people just come in, pay 10p, do the blood pressure. I don't know. But there are things that we could do to bring people together, to promote that health promotion and to work alongside those things. And then obviously measuring or success, or the measurement of success, is the prevalence approaches to promoting health and well-being is essential to ensure that the resources are being used effectively, and success can be measured in a number of ways. So it could be measured in the number of appointments, the number of illnesses, are they going up or down? And again, we have quantitative and qualitative ways of looking at that. So quantitative, the numbers, so the numbers going up and down, and qualitative, getting feedback from people and raising awareness. And I think health and wellbeing promotion should start at schools. We should be explaining to children about health and wellbeing. That's what's important. You know, why should you be eating vitamin? Why should you be having regular exercise? How do you manage your feelings effectively? Indicators of success are important to measure health, to understand the prevalence and the approaches of promoting health and wellbeing that are working. These indicators can be quantitative as well. You know, if we can look at the number of people who've quit smoking, and qualitative, such as the improvement to health and wellbeing. So just measuring those just makes us know that we're going the right way. The challenges and the barriers that we face. So again, one of the biggest challenges when using the approaches to promote health and wellbeing is obviously about taking action. And taking action, many people may not be seen to be able to do that. That may be because they can't see the immediate benefits, they haven't got time, they're not going to prioritise this. Then maybe their attitude, it's never going to happen to me. There could be lots of denial stuff going there. There could be cultural barriers, social barriers, economical barriers, all of the barriers in the world. But what I would say is that community health and wellbeing practitioner, ask them, create do a survey, find out why people aren't going for their health checks. Why are people not wanting to commit to a lifestyle change? And, I know from my experience that when I talk to people, and I say to, people, do you smoke? The first thing I get is, oh, don't lecture me on that. And I go, no, I'm not going to lecture you. Just curious, do you smoke? And when they go, yes, I go, how does that work for you? And they're like, well, it actually, it chills me out. And I go, but does it? Because smoking naturally increases your heart rate, and it acts as something that's a diuretic, so it pushes you up, it reduces your oxygen level. Or if you're drinking, I need a drink to go to bed. But that's not how alcohol works. It may give you that drop-off effect, but then through the night, you'll dehydrate, you'll want to go up and you'll urinate more. But I never lecture somebody. I go, no. I tend to say to people, look, if this is what is helping you now, I don't want you to be worrying about it, but let's stick it on your radar and let's look at those alternatives. Let's not just go, no, but what can we do to work together to achieve some of these goals? Anyway, you'll find your lane on how you can promote and reduce barriers. And again, some of those barriers can be reduced via social prescribing. So thinking about access and accessibility. And finally, then, looking at sustainability, it's a crucial component to the prevalence approaches to promoting health and well-being. By taking a sustainable approach, we can ensure that the efforts to promote health and well-being are effected long-term and are longer lasting. Because we don't want people to change overnight. If they change overnight, it's not sustainable. They're not going to do it. But if people just do little and often, and they do the long haul rather than the short haul, the problem is everybody wants the change immediately. And unfortunately, health and well-being, that's not how it works. If it were, there'd be a lot of money to be made in it, right? You know, weight loss, it's a couple of pounds a week. Yes, you lose it quicker by all these ridiculous diets out there. It's not sustainable. All that happens is you eat, it comes back. You know, and I've done all of these diets over the years. I literally could have a glass of water and I gain 3 pounds. It's not sustainable. You come off of it, it comes back. What's sustainable is healthy eating habits. So I don't even like the word diet anymore. I think it's a dirty word. I think it's just be abolished. When I say the word diet, it actually causes me anxiety. But when somebody says, but Steve, don't do a diet, just do a healthy eating plan. Just look at a healthier lifestyle choice. Just knock some of the bread on, knock some of the crisps on and swap it for this or this. Just swap it. And I go, well, that doesn't sound so bad. And then you do it. And it's a bit more sustainable. So again, it's that psychology, isn't it? So sustainability is all about the long-term haul. Don't look at it as a life. Don't look at it as a switching thing. Look at it as a lifestyle change. Slightly more sustainable. Policy recommendations. So one policy recommendation for promoting health and wellbeing, the prevalence approach is increase funding for community-based programs. Of course, that would be great. I don't think it's going to happen. But we can look at things around education resources. And when I did this program last year about universal healthcare, in there we had the University of London Southbank University. So they were running this universal healthcare project. And what was very clear from this project, and there was about 100 of us in the room, and we were split into little groups. What was very clear straight away, everyone's first answer was, we need more money. And I kind of wanted to bang my head on the table and went, but we've had all the money in the world and it's made no difference. The more money we give, the more people expect. What we need is to use the resources that we have. What we need is to start changing things from a much earlier age. What we need is better information, advice and guidance, which is already there. What we need is a joint up process so the schools, the hospitals, the doctors are all working together. And all of these recommendations about levelling up and poor inequality, I just had to say, but we have programs for people from unrepresented areas to get into employment. There are scholarships. There is additional funding. We've now got, young people who do their GCSEs, their A-level, their T-levels or BTECs or whatever it is, their apprenticeships, and then they can go to they can do their apprenticeship degrees. So there's that whole funded pathway in. It's there. We're not throwing more money at it isn't going to make it work. So we need to think about how do we make it work? Because at the end of the day, we're in a cost of living crisis. There isn't going to be more money for promoting health and well-being. We have what we have. We have a wonderful website, wonderful internet system with loads of stuff and resources. We've got wonderful technology. We've got AI coming out. It's all there. We just need to work smarter. Again, for recommendations, we've got access to lots of groups of people. We just need to work together. So whether that be community projects, whether that be farming stuff, whether that, look, farms are having to recruit people from overseas to pick fruit and veg. Well, here's an idea. People that want exercise, people that need additional food or whatever, Why don't we talk to the farms and go, look, can we not do a community day where we get people in, they take home a bit of fruit and veg, they get their exercise, they get something that they need, and it's a win-win for everyone. And I think this is the initiative that we need to start thinking about. How do we get win-win-wins for everyone involved? And the more we think, the better we are. And we were great in COVID. We just need to now use some of that thinking in our role of community health and wellbeing practitioners. So individual recommendations, again, by all means, let's survey this. Let's do some survey monkeys. Think about a survey that you could send out to your friends and family and collect some of that data. And what I'm going to do is I'm going to put some health promotion stuff in the announcement boards and just, try it. Say to your friends and family, is this something that you would do? Yes, no. If yes, why? If no, why? And let's see what we can do to make changes. So in conclusion, promoting health and wellbeing through the approaches is essential. By addressing wider determinants for health, including social, economic, environmental, and behavioural factors, we can improve outcomes for individuals. Of course we can. Including communities, health promotion strategies such as education awareness, behavioural change, policy and legislation, community projects, and collaborative and partnership working can be used to achieve these goals. It's all there, isn't it? It's all there. We don't need more funding. We just need to work smarter. Measuring success can be through the reduction of illness or increase access to healthcare and improve quality of life. So if you are a community health and wellbeing practitioner within your service, what would be interesting to see is from you starting this program, have you reduced the amount of people going to hospitals and using services? Are you seeing an improvement in people's health and well-being? And, ultimately, do you feel that it's been worthwhile? So there are going to be some great, interesting things there. Again, some references there just for you to have a look at. Wonderful. So that's the PowerPoint presentation. So what we'll now do is just run through the rest of the learning materials. So knowledge duty 1, using the preventative approaches to promoting health and wellbeing. So here, as a healthcare professional or caregiver, duty 1 is centered on employing preventative approaches to promote health and wellbeing to groups and communities. So key responsibilities then, assessing health needs, conduct thorough assessments of individual groups and community population. This process involves gathering relevant data, engaging with stakeholders and understanding unique factors to contribute to health and wellbeing. So it's those health factors to the communities in which you live and work within. You need to develop preventative programs. So you need to develop even more because they're already there, but you need to understand them. Again, you can design further ones based on your specific groups. You've got health education programs, so provide health and education programs and raise awareness, empower individuals in the community. There's some collaborative and partnership work in there to do. Address some of the social determinants of health, so recognize the health outcomes. Early intervention, look at some of the behavioural change stuff, so start to look at some CBT modelling. So that might be CBT for smoking cessation, eating healthy. I'm going to put that in the announcements up here as well for you. Advocate for public health, and obviously evaluate and empower those communities. So that's what we're looking at there. So the wider social determinants that impact physical, mental health and well-being. There's the psychosocial factors such as income, education, employment. And again, if we want to change those, it's psychoeducation, right? So income could be from benefits. So there's charities out there and organisations that do benefits review. It may be about getting a better paid job. So that could be through education or through maybe changing jobs. Through education, they could talk to training providers or colleges or universities. And through employment opportunities, they could be looking at maybe education to improve those. So there's lots of different support networks there for this. Social support networks and networks, so looking at who's around them to promote health and well-being, managing that lack of isolation. So if you think about the elderly population and social deprivation, we've got things like Age UK, befriending services, and all of that stuff. Housing and environmental, so there's Shelter as a charity, there's social housing that hold those contracts. So there's things there that we can do to help promote information there. Education literacy, so education equips individuals with knowledge and skills at higher levels of education, improve health literacy and healthier behaviour. So again, lots of information, advice and guidance, lots of online learning. Employment and working, so again, job security, trying to move people out of those 0-hour contracts into longer term contracts. Access to healthcare, so that could be online information as well as face-to-face. Cultural and social norms, that's looking at the stigma, trying to work around that and changing things. You've got your nutrition and food security, so thinking about access to food, those food deserts that we were talking about earlier, and then policies. So again, think about political and economical factors there. K2 then looks at the cause of mental, emotional, and ill health. So causes then, here, some key factors, could be lifestyle factors, again, social factors, health, mental health challenges. So again, chronic stress and traumas and adverse childhood experience called ACE. Children that have experienced trauma or adverse childhood experiences are more likely to experience depression, anxiety, and mood disorders. So again, are they getting the right therapy, the right support, the CBT and counselling? Environmental hazards, poor air quality, respiratory diseases, etc. Aging and chronic conditions. So again, access to community support, dementia and awareness. So the charities and organisations there that we can refer people to get support. Genetic conditions, so that are hereditary, but again, there's genetic screening now for all of this. Lack of healthcare, so mental health stigma, and then substance use and addiction. So they are key factors. And in all of those key factors, there are solutions. There's a thing called solution-focused therapy, which is great because you can sit down with someone and say, well, what can we do about this? What do you think would be really useful? Or how can I best help you? And let's look at it together. Or there's social prescribing. So just if you look at, so for social prescribing, so there we've got the Hub of Hope. You could pop in your postcode. And let's just say I'm in crisis, show results. There you go. So it brings up all of the stuff for you. So straight away, you can click on that and go, okay, well, that one's closed. That's no good. And we can just keep going. So just knowing some of this stuff is going to really, really help you. Opportunities in prevalence and management. So again, management of this, then promotion, early detection, accessibility, social networks, behavioural interventions such as CBT, policies, interventions, chronic pain management, and mental health awareness trainers and mental health first aid. Again, you will do that online via the VLE. Looking at the negative and positive impacts of different agencies of improving health and well-being. So negative looks at inadequate healthcare access. So there's definitely a problem there of people accessing their GP, but there's a lot of work going on around there. But again, can we access it in a different way? Stigmatization, discrimination, environmental unhealthy marketing and promotions. Talked about that earlier, right? And poor working conditions. But positive impact is accessibility to healthcare services. So that could be early intervention services. We've got mental health support agencies, health promotion, social services support, advocacy for health inequalities, environmental protection, workplace interventions, and collaborative effects. So there's a lot of positives there as well. And it's about working, obviously understanding the negative impacts, because if we understand the negative impact, we can have, we can be less judgmental and a bit more solution focused. And looking at those positive impacts, we can use that to sell the idea. How psychological, behavioral, and cultural factors contribute to play to mental health of people and how this can impact others. So psychological factors, we can look at then things like our stress and coping. So if you go to my YouTube channel, The Mental Health Nurse, I give you videos on how to manage stress and coping skills. And that's things such as progressive muscle relaxation, so tension body relaxing, breathing skills like the figure of eight, the rainbow, square breathing. There's lots of different ways there. And again, looking at healthier ways to manage stress. Mental health, looking at those psychological factors such as depression, anxiety, and trauma. This obviously can have a profound effect on people. But the great news is now there's loads of new stuff coming out. For anxiety, there's a pulse thing that you can put on the back of your neck that stimulates the vagus nerve. There's a headband that you can wear that delivers like an ECT, electric compulsive therapy, which is called Flow, and it sends signals through the brain to kind of relax you. There was a recent study done around B6 being as good as an antidepressant than SSRIs. So there's lots of stuff there which we can do just to give health promotion to promote those psychological problems. And resilience, gosh, yeah, absolutely. Resilience is the result of good mental health. And let's not forget, resilience comes through life experiences. And it's that wonderful saying, what doesn't break you makes you stronger. Nobody wants to go through tough times, but it's an inevitable part of life. But the more you go through, the more you realise, oh, actually, it's not that bad. We'll get over it, and we become resilient. So the problem is, if we remove this from people, so if we don't let people fail, if we don't let people fall over, if we don't let people learn the hard way, they're never going to gain resilience. So I'm not suggesting we're mean to people. I am merely suggesting that we can't keep protecting everybody. They have to learn to become more resilient. Oh, you can't see somebody who's deceased because you're like, well, if you're going to work in health and social care, the chances are that you're going to walk into somebody once who's deceased. So far better to do it with somebody there than you walking in on your own. We need to kind of move up this level of resilience. And part of being a community health and wellbeing practitioner is building resilience, looking at resilience skills to make people far more resilient. And in fact, I'm actually going to do a video in my mental health nursing on YouTube for resilience because it's such an important thing. Behavioral factors then, looking at those lifestyle changes, diet, exercise, substance, and sleep. So sleep, there's a thing called sleep hygiene. Again, lots of stuff on the apps, lots of stuff on the phones that you could have a look at. Diet, again, lots of apps there to manage that. Weight Watchers and Slim and What are definitely behavioral led. Healthy habits such as vaccination, screening, checkups, maintenance. So that's all your health promotion stuff. And then cultural factors, looking at those benefits and social factors and cultural stigma, and looking at how we can manage those slightly better. And then impacts on others, family and social networks. So again, providing that information to everyone. The workplace and community. So we could be going to schools, colleges, churches, and places of work to just give that information and start building networks to support that. And then healthcare systems. So again, looking at the ways of reducing the burden. And that could be things such as, drop-in clinics, walk-in clinics, using your GPs more, using not your GPs more than anything, in fact, using your pharmacist more. Health inequalities. So if we look at health inequalities, the impact on health inequalities, obviously a reduction of life expectancy. However, I think we are living longer. The health inequality for men and women is now narrowing. But did you know that if people with mental health who take mood stabilizers, or antipsychotic medication, be careful on that, they can have a life-limiting effect by 15 to 25 years. So that health inequality is still there. Higher prevalence of chronic conditions, absolutely. So physical health, so if we're not moving, if we've got, if we're obese, of course we're going to have problems with our back and our mobility. The weight we're carrying, the pressure on the heart and the respiratory conditions. Limited access to healthcare because obviously the stress, the access, the screening, delay in diagnosis and all that stuff, and then poor nutrition. So again, socioeconomic malnutrition and poor eating habits. Impact of mental and emotional health, increased stress, social isolation, stigma and discrimination, and limited access to mental health services. And they are stretched. They are all stretched at the moment. I remember, just going back earlier in the year, when I was working in surgery, you were waiting 3 to 4 weeks to see me for a 20-minute appointment. I was going through 40 people a day. It was grueling. And for me to get you a referral, you were looking between 6 and 8 months before you could see somebody else. So actually, your role as a community health and wellbeing practitioner is going to be such a fundamental impact on these people because they just can't get anyone, and the charities and organisations are all at stretching point as well. So things like the Samaritans and Shout and all of that lot, they do a sterling job there. Impact on wellbeing, obviously there's a reduction in quality of life, limited education, limited incomes, and intergenerational impact. So again, maybe some behavioural stuff there, or ideologies and thinking being passed down through families. And addressing health inequalities then, the way to address those, we're looking at health inequality policies, more accessibility to healthcare, more support for social support programs, more training around mental health awareness for everyone, raising that awareness, promoting those early interventions and treatments, and trying to stop people getting to crisis point would be great. And community-based interventions, so looking at community support groups to help more in managing that. So we are now at the end of duty 1. You've got some questions there. You're going to hit that question, so go to next. And as you do those, you need to pass them. And then finally, looking at skills then. So for duty 1, the prevalence of promotion to individual health and wellbeing community groups. No, actually, we're going to do this one next week. So next week, we're going to look at recognise and help others to recognise the factors, assist individual groups, help groups and communities, and work with people and communities to identify access and local resources. So that is next week's session. So what you will see under the announcements is I'm going to put together some health promotion stuff. I made a note about vaccination campaigns. I'm going to give you some information about cognitive behaviour, so behavioural science, and some resilience in the announcement stuff. So I hope you found that useful. Quite a lot to cover in duty 1, but it kind of sets the pace and the tone for everything else. And I'm hoping what you're getting from this is you don't need to be an expert in all of these areas. That's not what we're asking. To be a community health and wellbeing practitioner, it's all about knowing it's there and signposting, listening to people's stories and then giving the advice and guidance, you know. And we can do some role plays later on about how we can do that, and we'll do some case studies as well. So thank you very much for watching. I hope you found that useful. Do those 5 questions. Let's get on top of this, and I will see you all next week.